So we're just going to get started. The format of this panel is to present the 5 priority issues or actions that are recommended in the 3 different areas. And that will be a prelude then to hearing from Jim Hybe on USAID reflections over the last 2 days. And then we'll be going to the final session. So I guess we'll get started. We'll, I think, take the rogue group first that insisted on 8 instead of 5. So Pierre, up to you. It's not surprising that the rogue group would be led by Pierre.
I think it's way too much information. So we had a very informative and lively group with really great contributions from everybody in the group. And so, as Sheila says, we did really end up with 8 categories, but there were some that got a lot more attention than others. The one category. So I'll just give you the 8. Okay, the 8 were in no particular order except for the first, which was the most important. The first was failure to recognize and learn from success. That was the one that generated actually probably almost 50% of the conversation. The second is that there are many versions of quote-unquote QI, and we can talk a little bit about some of the ideas from the group about how to think about that. There was and the way that we'd framed it is what keeps you up at night, what do you worry about? And so the next one was around building the capacity to understand and practice quality. Is that there wasn't enough attention to that to allow us to practice effectively. The issue of patient-centeredness and engaging with the providers was felt to be a neglected area. Motivation came through, and this may weave into many of the other topics, but there was a concern that we really didn't have a handle on the issues of motivation, and I can expand a little bit on that. A strategy for can we be more strategic about the practice of quality? What are we going to put our money in to, and how can we show value in what we're going after? And then finally, balancing practice and policy. So those were the 8. Do you want me to carry on?
Sure. Why don't, if there's something more that you want to explain related to key themes, and then we'll take 1 or 2 questions and then go on to the next.
Yeah, I'll spend a little bit of time just talking about the first one, which generated all of this conversation. So there was a sense, sort of on 2 levels, that we just don't have a way or a place to systematically learn from our ongoing experiences. That there was a sense that we were wasting time and not being efficient by reinventing the wheel. We had no way of communicating, or not good ways of communicating and sharing across our experiences, that there are thousands of QI teams active now around the world. They don't, but without a place to go to learn or to teach. We need to be clear about what we don't know. So the things that we know work. Everyone's doing PDSAs and experiential learning, but what do we really know about motivation? And we need to narrow down on those questions. So that was the sort of, so there was a very rich discussion in that. I think the second biggest area was on this issue of motivation. And I think that may go into the research area as well, because it was felt that really understanding what motivates people, both internally and externally in terms of incentives and aligning incentives, was something that really needed more attention. Understanding the pulls that providers feel in different directions could really do well, and that also comes down to a theme for the 2 days, which is around trust, motivating better interactions between clients and providers and between communities and health systems.
Questions from anyone for clarification or from the members of the group as far as amplification? Okay, it's the postprandial slump. I do have a question, and that is, did you talk about any ways to address number one?
Now, what was number one? Oh.
Failure to recognize and learn from successes.
No, I actually don't think so. We were just, I don't think we really came up. Maybe people from the group can help out here. I think there was, the only one I'm seeing here was a suggestion about a centralized database. I think there was another comment which I thought was really interesting, which is one of the most compelling ways of learning from our experiences is through well-constructed case studies. And, you know, there's been a lot of conversation at this meeting about systematic approaches to research, but we shouldn't forget that there is a very quick way of sharing our learning through well-defined case studies.
Did you want to add, Gary? Okay. Yes, Bill.
I guess I have a comment for that, is that you know, we have a lot of experiences in healthcare, and we learn about them all the time. This is a place where we don't really do it very well. So how do we do it well? Yeah. Well, we have professional conferences, and we have venues for with which we share these things. And maybe one thing that USAID could convene something that would allow this to happen, either in an annual conference or, you know, focused on this particular issue, sharing experiences, because it isn't happening spontaneously. And so if we don't do anything differently, we're going to get what we got now. Mm-hmm. And so, or maybe there should be some kind of you know, interest group, users group, peer learning environment, et cetera, but it's going to have to be facilitated and supported. That can take a lot of facilitation and support, probably more logistic support than money. But if nobody does anything to make it happen, and we just be flapping our hands at it.
Right.
And so a modest investment of I agree this is a huge issue, and a modest investment of effort and energy by USAID could magnify the effects of all the stuff that they're doing.
Okay. Other comments, questions? Okay, let's move on to policy.